Hello, welcome back to my channel. I am Dr. B.S. Arora, psychiatrist by profession. Today, I will discuss about nicotine addiction, understanding nicotine addiction and breaking free from the chains of dependency. Nicotine addiction is a formidable challenge that millions of the people face worldwide. Despite its well-documented health risk, the addictive allure of nicotine continues to ensnare individuals from all walks of life. From cigarettes to cigar to vaping devices, nicotine consumption manifests in its various forms, each carrying its own set of risks and consequences. In this video, I will go deep into the intricacy of nicotine addiction, shedding light on its physiological and psychological mechanism. Moreover, I extend an invitation to a counseling session aimed at empowering individuals to break free from the grip of nicotine dependency. Nicotine is a highly addictive chemical found primarily in tobacco products. It exerts its influence by binding to nicotine acetylcholine receptor in the brain. Upon inhalation, the nicotine swiftly crosses the blood-brain barrier, triggering the release of neurotransmitters such as dopamine, which are associated with the feelings of pleasure and the reward. This neurochemical cascade forms the basis of nicotine addictive properties, as an individual often seeks to replicate the euphoric sensation induced by nicotine consumption. Its nature of dependency. Nicotine addiction operates on a cyclical basis characterized by craving, consumption, and temporary relief. Over the time, individuals develop a tolerance to nicotine, necessitating the higher dose to achieve the desired effect. Consequently, what begins as a casual experimentation can quickly escalate into chronic dependency as brain adapts to the presence of nicotine and crave for its euphoric effect. The habitual nature of nicotine consumption further reinforces this cycle as an individual associated certain activity or an environment with smoking or vaping. Its health implication. Beyond its addictive nature, nicotine consumption poses significant health risk, contributing to the myriad of adverse health outcomes. Smoking in particular is a leading cause of preventable death worldwide, with tobacco-related illnesses accounting for millions of fatality annually. From respiratory condition known as COPD to cardiovascular disorder like heart disease and stroke. The detrimental effect of smoking extends beyond the lung. Moreover, emerging research suggests that vaping, once heralded as a safer alternative to traditional cigarettes, carrying its own set of health concerns, including lung injury and cardiovascular complications. Psychological factors. While nicotine addiction has clear physiological underpinning, its root often extends beyond mere chemical dependency. Psychological factors such as stress, anxiety, and social influences play a pivotal role in perpetuating nicotine use. For many individuals, smoking and vaping serve as coping mechanism, providing temporary relief from life uncertainties and pressure. Furthermore, societal norm as a peer pressure can contribute to the normalization of nicotine consumption, particularly among adolescents and young adults. Understanding its psychological dynamics is essential for developing its effective strategy for smoking cessation or quitting, breaking free. Counseling for nicotine dependency. Recognizing the multifaceted nature of nicotine addiction, counseling offers an holistic approach to cessation or quitting by addressing both the physiological and the psychological aspect of dependency. Counseling sessions provide individuals with a supportive environment to explore its motivation for quitting, identifying triggers for nicotine use, and develop coping strategy to overcome craving. Moreover, Counselor utilizes evidence-based technique known as cognitive behavior therapy and motivational interview to empower individuals on their journey towards nicotine-free life. CBT, for instance, help individuals to challenge and reframe maladaptive thoughts, behaviors associated with nicotine use, promoting healthier coping mechanism and decision-making skills by targeting cognitive distortion and reinforcing positive habits. CBT equips individuals with the tools necessary to navigate craving and overcome relapse triggers. Similarly, group therapy, by exploring the discrepancy between the individual values and their nicotine use, eliciting commitment to change and enhance self-efficacy. In addition to the individual counseling, group therapy sessions offer a valuable forum for a peer support and shared experiences. By connecting with others who are undergoing the similar challenges, individuals feel validated in their struggles, gain encouragement from collective progress. Group dynamics foster a sense of accountability, reinforcing the commitment to quitting and celebrating the milestones along the way. Furthermore, counseling session may incorporate adjuvant therapies such as mindful based meditation techniques, relaxation techniques, and stress management strategies to address the psychological component of nicotine addiction. By cultivating mindfulness and emotional awareness, individual can learn to observe craving without judgment and to respond with greater resilience and self-control. Additionally, stress reduction technique equips individual with healthier coping mechanism, reducing the reliance on nicotine as a maladaptive coping strategies. And in the end, nicotine addiction presents as a complex interplay of biological, psychological, and social factors, requiring a multifaceted approach to cessation. By understanding the mechanism of the addiction and addressing the underlying motivation and the triggers for nicotine use, individuals can embark on a journey towards lasting freedom and improved well-being. Counseling sessions offer a supportive and exploring environment for an individual to confront their dependency and develop effective coping strategies and ultimately reclaim the control over their life. If you or someone you know is struggling with nicotine addiction, we invite you to join us on the path to the recovery. Together we can break free from the chains of dependency and embrace a healthier and nicotine-free life in the future. You can contact us, you can email us. All the details are given in a description. Thanks for listening.